The National Malaria Elimination Programme (NMEP) says it has distributed over 17 million insecticide-treated nets as part of effort to curb the scourge of malaria in 6 states in the country. The states are Adamawa, Benue, Kwara, Plateau, Osun, and Zamfara. According to the National Coordinator NMEP, Dr. Audi Mohammed, the gesture is in view of a disturbing survey indicating that 53 million malaria-related cases are being recorded in Nigeria, with an annual death toll of about 81,640, of which 23% of the cases are children from 6 to 59 months. Speaking at a media chat in Abuja, the NMEP Coordinator, represented by the Director, Surveillance, Monitoring and Evaluation, Dr. Perpetual Uhomoibhi, said about 13 million children under 3 to 59 months of age within the Sahel region have also benefited from NMEP intervention.
As conveyors of information, molders of public opinion, and advocates stimulating public discourse to promote the consistent and correct use of ITNs. Studies have shown that this reduces child mortality from all causes by 17% compared with using no nets. In addition, in areas of stable malaria transmission like Nigeria, consistent and correct use of ITNs reduce parasite prevalence by 13%, uncomplicated malaria episodes by 50%, and severe malaria cases by 45% compared to equivalent populations with no nets. There were issues of stigma and fear that tended to hinder individuals from attending health facility. And it could have also partly accounted for why we had a reduced number of fever cases and malaria reported in 2020 compared with the figures for 2019. Abiding by preventive guidelines, motorists decreased numbers of passengers and increased the transport fares, further alienating some who could not afford the charges from visiting health facilities.
Furthermore, the NMEP Director in charge of Technical, Professor Olubenga Mogola, in his presentation, warned against disruption of malaria intervention in Nigeria, especially as it relates to increase in mortality rate.
Run a percentage mortality of COVID that is less than 2%. COVID, we respect it because the figures are highly dramatized. And so because it is being counted every day, and because it is visible, and above all, COVID is touching important people in the society, there's no doubt that the panic that it has generated, the voiceless, the vulnerable, but equally human beings, life for life, are affected much more. 9 persons die of malaria every minute. Okay? So, as we are talking, if one person dies of COVID now, NTA will carry it, and all the news media will carry it by evening. But 9 persons die every minute of malaria. So we needed to help policymakers to ensure that we run a resilient health system. What do you mean by resilience? Resilience is your capacity to handle unanticipated challenges without disrupting your existing system.
Theme of the media chat is Delivering Malaria Intervention in the Context of COVID-19, How NMEP Has Fared. Palang Booker, CNN News.